everybody. How's everybody doing on this rainy day here in Chattanooga?
Good morning, everyone.
Hey, Kelly. I don't know about y'all that who are not downtown, but I swear every time it rains, like something with the EPB Wi-Fi downtown, or not Wi-Fi, the our internet gets kind of slow and weird. So hopefully it'll hang in there with us today. Don't tell EPB I said that. But we've been having some connectivity issues, but I think we should be okay now. Um, we are so excited that so many of y'all are here today. For those of y'all I don't know, I'm Abby Garrison. I am our Vice President of Community Investments here at United Way of Greater Chattanooga. And that means I get to do lots of cool, fun things, mostly with nonprofit partners. And one of those is our actual community investments process. So, really excited for those of y'all who are coming along with us. We are going to record this. I know it says it up top, but just wanted to make sure people realize we are recording it, really so that those who couldn't join us today at this specific time can still get this great information from Sarah. So, um, I'm gonna turn it over to Brian and let him introduce Sarah, and then we'll bring it back home at the end with a little bit of more information for United Way about our community investments, and then really want to make sure that y'all feel like you can ask questions, ask for examples. Like we've saved plenty of time for discussion and brain picking, if you will, from Sarah and her expertise. So let's take advantage of this time. Sarah, really appreciate you carving time out of your schedule to share your expertise with us here in Southeast Tennessee. So
Thanks. I'm so happy to be here.
yeah, I'm gonna hand it over to Brian and Sarah.
All right, thanks, Abby. Yeah, and welcome everybody, and thank you so much, Sarah, for joining us. Sarah is the director of Two Gym Practice at the Ascend at the Aspen Institute, and Sarah will share here in a little bit the history of Ascend and Aspen and how that fits into today's conversation. But we've known about Aspen for quite a while. They have wonderful, wonderful resources for any of us in the nonprofit world to access, and I'm sure Sarah will touch on many of those today. United Way is moving into our 2030 impact agenda, which Abby and I will discuss a little bit about, and a two-generational approach to through our entire organization, not just our grant making, but through our advocacy and other areas, is going to be highly, highly emphasized over the next 5 years. So, with that, Sarah, we welcome you and thank you for your time, and looking forward to all the great info you're going to share with us today.
Sure. Thanks so much, Brian, and thank you to the United Way and Abby for your leadership. I'm really just delighted to be here with you this morning. And the work that's happening in your state from a 2Gen perspective is actually really exciting. Your state has been a leader in this work. And Dr. Raquel Hatter, formerly with the Department of Human Services, is an Ascend Fellow. And at Kresge, she's been a real proponent of these approaches. So today I am really going to give a 2Gen 101 overview, an introduction to 2Gen approaches. And I'm going to try and keep this to about 20 minutes and then welcome questions. And you can put questions as they come up in the chat. And we can revisit them, or raise your hand when I'm done and we can have a conversation. But really, this is to get us all oriented to what the approach is and where to get started with this work. And because my multitasking skills are not what I wish they would, Brian is generously going to do the slide. So you'll hear me say next slide. So thank you, Brian. Next slide. So a little bit about Ascend at the Aspen Institute, really to put this presentation and the way the 2Gen approach will be discussed into context. I'd like to talk a little bit about who we are. So Ascend at the Aspen Institute is a catalyst and convener for systems, policy, and social impact leaders who are working to create a society where every family passes a legacy of prosperity and well-being from one generation to the next. The focus that Ascend has had on building a movement around the two-gen approach is really an outgrowth of Ascend's founding call to action, which was to shift the way services and policies viewed and addressed economic prosperity to a whole family lens. So as such, Ascend's North Star is really about better outcomes for families, and one key approach to getting there is the two-gen approach. The Aspen Institute is based in Washington, D.C. That's where I live and work. We are on the ancestral land of the Piscataway people, and we are a team of about 30, give or take. But we have half our team here in D.C. and half our team is fully remote. Why are we called the Aspen Institute? The Institute was founded about 75 years ago in Aspen, Colorado, and we have a campus there where we bring our network and partners annually to convene and really reflect on and take action on some of these approaches. Next slide. So what is 2Gen? I want to just note that when we refer to 2Gen, it's really reflecting and embracing the diverse sizes and structures of families to ensure all family members can reach their full potential. And it's crucial to acknowledge that Ascend did not coin this term, nor the approach that is described as 2Gen. The intuitive connection between children and adults in their collective success has long been recognized by Indigenous communities. And as you can see in this image, there are many terms that have been historically as well as presently used to represent the same intention with the term 2Gen. In Hawaii, they call it ohana nui, which is a multi-generational approach. We believe that any term can be used to describe the approach, with particular emphasis on the use of terminology that matches the community within which the approach is being described. Next slide. So let's get a little bit more specific on what 2Gen is. When we think about services that have traditionally sought to support families in the US, we can pretty quickly identify programs for children and programs for adults. And although children and adults have different needs, there's also significant overlap within a family system that is not addressed through separated systems. Ask any parent who's trying to get to their job when school starts, when you're supposed to be at that job, and we can have a conversation about how certain systems don't talk to each other. But over the last 20 years, quite a bit of data has also emerged that reinforces the greater opportunity for mobility when services and systems for children and their caregivers are actually integrated. And I'll share more on that on an upcoming slide. So the 2Gen approach highlights programs, policies, and systems that build family well-being by intentionally and simultaneously working with children and the adults in their lives. So if we start on the left side of this image that says child-focused, we might quickly think of childcare centers, Head Starts, classrooms, children's hospitals, or pediatricians' offices, which focus on the well-being of children, as they should. But if in addition to addressing this need, we apply a 2Gen lens, we recognize that children and their well-being just can't be viewed in isolation from their family and their well-being. So this might look like a childcare center that includes an intentional economic mobility programming for caregivers of children enrolled there. And in this way, children are receiving crucial developmental and educational support, while their caregivers receive economic coaching supports that increase the financial well-being of the whole family. And that also reinforces the goal of the child care center. You could also start on the right side where it says adult focused. Here we might think about a workforce training program or a community college that historically tailors its services to individual adults. We know that 1 in 5 students on a college campus in this country is a parent. So when looking at these spaces with a 2Gen lens, a college campus might have a childcare center, either on-site or co-located, and there might be a family study center attached to the library so that caregivers can study for their classes and attend them while their children are being cared for. And here again, the needs of children and their caregivers are being met intentionally and simultaneously. I just want to note that I've given very programmatic examples here. There's other examples I'm happy to talk about that are more related to policies and systems changes. So at this point, you've gotten a brief description and example of the 2Gen approach. And this is a timeline that provides a little more detail on the origins and the evolution of the 2Gen approach in the US. As I mentioned prior, we have to consistently recognize that the notion of 2Gen is not new, and it's actually rooted in indigenous wisdom. And in looking further along the timeline, I want to highlight that the term 2Gen was coined in the late 80s by the Foundation for Child Development to reflect programs that were emerging across the country. We've really retained this term in homage to that work. In 2012, Ascend published our first publication, which was called Two Generations, One Future. And that really laid the groundwork for launching our network to foster the development of the field. We continue to grow our network. So we have a national network of nearly 600 organizations. We have a national fellowship of about 180 leaders, and we have a pretty robust communications and narrative change strategy, which includes convenings, products, and tools to strengthen the 2Gen field. Next slide. So we've covered a broad definition of 2Gen and a brief history of its origin. And with this graphic, we're going to just go a little bit deeper into the larger systems approach of 2Gen. This graphic represents what we call the gears or components of 2Gen. And I find it somewhat easy to consider these as the what of 2Gen. We can think of these components in two parts. One, the supports and services that a family interacts with and needs to thrive. And two, the systems at a city, county, state, and even federal levels that drive the funding and policies that have implications for families. Since 2Gen recognizes the interconnectivity of children and the adults in their lives, the what of 2Gen broadly is also inherently connected. So with each of these cogs representing a body of research, programs, and policies within themselves, what makes the 2Gen approach powerful is the integration of all of these as a holistic system of family well-being. Next slide. So Brian, this slide is animated. I can just share a couple of tangible examples here. You can click through them all so that all of the gears appear. And what you'll see here as Brian clicks through are examples of essentially a hypothetical family and the way they interact with the components, really to bring this graphic to life. So starting with economic assets, you have a family composition as a family of three, a single parent with two children living in subsidized housing. The children are 2 and 7. One is enrolled in a Head Start program. The other is in first grade. The parent has a GED, has limited job prospects, so they're considering a post-secondary path, but overwhelmed with balancing this and their children's needs. The health and mental health needs are present for the family, with the youngest child needing some support, and the parent has had challenges with their own health and mental health, given the competing needs within their family. The family really needs to feel more connected to their community. They're isolated, which means the parent does not have as much support as they could have. So this is where, from a family perspective, the different components of the 2Gen approach impact the family, but also present a pretty significant opportunity for how the family can get supports and access resources. Next slide. We're coming back to this slide just to take a moment to pull the experience of a family into this graphic and see how a 2Gen approach realizes that multiple components are in motion when supporting family well-being. So for example, that parent who may choose to pursue a credential to increase their wages will also need additional supports for their children. That could mean after school programming, extended hours, and benefits, public benefits to maintain their children's Head Start slot. It may also mean that when that parent is bringing their child to their child well visits, they get access to financial coaching and tax preparation. We know the child tax credit, earned income tax credit can make a significant difference in families' lives. What does it look like to integrate that asset building into early childhood or health systems? So just a reminder as to where a family might be and where they could go based on the integration of these components. Next slide, please. So we've covered the what, We're moving into the how now. And these 5 guiding principles of 2Gen are what we often use to hold ourselves accountable to measuring outcomes for children and the adults in their lives simultaneously, while also being grounded in family voice, racial and gender and economic equity, and ensuring that we continue to encourage innovation in our solutions while aligning funding streams for sustainable practices. A lot of organizations come to us and say, we get it, we believe in it, we think this is the right thing for our community. Where do we start? And I think these principles are a useful starting point. Organizations, programs, policymakers, you can view these principles as a way to center the design and implementation of a 2Gen approach, consistently looking back to the principles and ensuring that all 5 are upheld in a way that has fidelity to what you want to do, but also is really taking into account how are you capturing outcomes for both children and the adults in their lives. Next slide, please. So we've talked a little bit about the origins of 2Gen, the what of 2Gen and the how. And this last part I want to highlight is really about the research that supports this approach. So in short, we believe that 2Gen is effective. And a lot of research has been done in the last decade around brain science and early childhood. We now know actually that our brains change at 3 important moments: when we're babies, when we are teenagers, and when we become parents. And this is true of fathers and mothers because it's about attachment. And that's a huge window of opportunity. As you can see under economic assets on the right, a $10,000 increase in annual parental income increases the quality of children's health into adulthood. So I won't read all of these off, but I think it's just important to note that beyond the outcomes that we've highlighted, each component has strong outcomes associated with it. And by pairing the principles, the how, with the cross-system approach, the components, we can continue to support the growing 2Gen field to provide stronger services and policies that support families. And I'm happy to talk a little bit more about what those data points look like across the field, as well as some data we've learned from 2Gen programs about how effective this work is. Because I also think it's important to acknowledge it takes time to develop these approaches, and it does take resources. This quote brings us to what I would say the close of my portion of the presentation. And it's a good reminder of what I think keeps us grounded in this work and why we do this work. A couple of years ago, we hosted a large convening here in Washington, D.C. There were a number of folks from the Biden administration in the audience, and someone stood up during a panel during which Janine McMahon, who is a parent advisor based in Connecticut, was speaking, and they said, you know, where should we start with this work? How will we know that we're effective? And Janine said very simply, don't just meet families where they are, meet us where we dream. And I will say, as a clinical social worker, a lot of my training was to meet families where they are, right? Like you meet families where they are and you follow their leadership and expertise. But what Janine was really saying is parents have aspirations and goals too. And we can't just give one member of the family a balloon and the other a dead weight. We have to think about the family holistically, and we have to really think about asking parents what they aspire to and begin to tailor and adjust how we're designing systems and programs to meet those dreams. So I try and remember that in this work, and I thought it would be a good place to end this portion of the presentation and turn it back over to Brian.
Hey, thanks, Sarah. And apologies everyone for the disruption there. Well, let's just pause real quick and just see what questions might anybody have regarding Sarah's comments here and the content. This is obviously very important stuff to not just to Unite Away, but to our community at large. So want to give it back to you all to see if there's any questions you might have.
I have no questions, but I just want to affirm that this is very interesting and I'm just absorbing all of this information. So thank you.
Sure. And, I know that it can sometimes feel like a lot of information. We have a number of resources and tools. And Brian, I'd be happy to work with you as follow-up to just share what I think might be the top 3 to 5 resources that help, for example, folks think about how you operationalize the principles I shared. Um, and Abby and Brian, I'm happy to work with you to figure out what resources might be most useful to this group, because it can be overwhelming to try and think about what kind of data and support you might need in starting to do this work.
No, excellent, Sarah. And yeah, we'll certainly touch base and we'll get a package together of all the materials and contents and maybe share out with this group here in a little bit. So we'd be happy to do that.
Sarah, that does kind of bring up a question that I have that maybe I'll ask on behalf of everybody else. Do you have any examples of nonprofits who have successfully kind of started small, or any advice on how to start that transition, right? Like it can feel kind of overwhelming if I'm a child serving organization. Oh my God, I suddenly have to serve their parents too. Like, how do you guys recommend
Yeah.
nonprofits kind of think through that beginning first step?
So I will say that I think the most important first step is to listen to the parents of the children you're serving. So let's say you're an early childhood organization that feels pretty strongly you want to apply a 2-gen approach or lens to your work. I think that creating a feedback loop or a set of focus groups with parents to find out what are their goals and aspirations and where are their gaps in meeting them, which doesn't necessarily mean the organization has to then create something that meets all of those needs. But I think too often what I have seen is organizations dive right into, okay, we have parents who we assume want better jobs or to make more money, and let's design a workforce training program, right? I mean, this has happened. There's one place where there was a robust group of Head Start sites. They had some philanthropic resources and they looked at the labor market and they said, okay, the biggest growth area is around welding, and we're going to design a welding job training program. And then it turned out not a single parent wanted to be a welder. And so I think really starting with listening to parents, because we have also seen there's organizations that assume that the workforce or post-secondary is the way to go. And when they talk to parents, what they hear is actually what they really want is a lot more support around mental health, or actually what they really want is a guaranteed income pilot. Again, it's not necessarily saying we can promise to deliver on everything we hear, but it is checking assumptions about what this approach looks like in a community and making sure there's an actual audience and group of parents who will participate in it. I would just say too, from a funding standpoint, we have observed that when you can document and demonstrate that you've heard from parents and what you are proposing to design reflects what they need and want, it is, I think, a more effective way of getting funding organizations to support a pilot or a public-private partnership around that work.
Yeah, I think that's really good advice. I mean, one of the things that we also see is just, nonprofits are busy, right? They're strapped for time and energy and resources themselves. And so it feels like, and we've seen some data here locally that um, there's a big opportunity for better collaboration. So like maybe you don't have to stand up the entirely new thing on your own, but instead it's like take some time, observe what your parents and caregivers need, and reach out to an agency that does that type of work already. So have you seen any successes of that type of like not starting something from scratch, but just partnership amongst agencies?
In terms of an organization deciding they were going to do this solo and without, or vice versa?
I think vice versa.
Yeah.
Doing it in part.
So I think that where we see that within within our work, we often talk about platforms for scale. So organizations that by virtue of taking a two-gen approach have the opportunity to influence the systems that they're in. And more often than not, it's a partnership or a collaboration than an organization doing it solely, because most organizations are simply not built to do so. I think a good example would be community action agencies, which in many communities have the capacity to provide the early childhood programming and some of the asset building, but not necessarily the workforce development or even, in some instances, robust health or mental health supports. So the where we've seen this to be most effective is where community action agencies, for example, can develop a partnership with the local community college or technical college and bring employers to the table to say, we know that you need a skilled workforce, and we are here to help support that. And how can we support you in this? And this is how you can support us, either through guaranteeing a certain number of slots for jobs and or providing some funding. I would say United Ways are a pretty big anchor organization in a lot of communities for this work, as are Goodwills, and as are community foundations and women's funds. I think that one of the things that has been difficult for organizations is figuring out what that partnership agreement looks like. And one of the tools that I can send as follow-up are we have some sample MOUs from Tulsa, Sarasota, the Bay Area, rural Michigan. They're all using a similar template that we helped design, but essentially it helps everyone identify not just the role they're playing, where the funding is coming from, and who's accountable to coordinating, but it also, those MOUs provide a set of shared measures that folks are reporting into an anchor partner on so that there can be some effective tracking of the outcomes that I was talking about.
That's great. That would be super helpful. There are a couple of questions in the chat.
Yep.
I don't know if can you see them,
I
Sarah?
can, yeah. So Anna, you're asking, do you have any examples you can share of communities that have collaborated to co-create successful two-gen systems where existing nonprofits lean in with what they do well and collaborate with others? Yes. So there are, I think, a couple of cities that have taken this on, but they usually rely on an anchor nonprofit partner as, for lack of a better term, the fiscal sponsor, because there is some flexible funding that is often needed. So Austin, Texas, for example, they had a consortium of partners, three community colleges, a few Head Starts, the Department of Mental Hygiene, the United Way, and then they worked with city council members to develop a vision statement for the city and talked for probably about 6 months in a series of planning meetings about what that would look like in practice. So a couple of examples of what shifted. They were able to better support student parents in the city who were attending community college and technical schools with co-located or increased referrals for flexible and accessible childcare. They worked with the Department of Transportation to expand busing hours so that families could reach their jobs and or childcare options more easily. And they also worked with the Department of Mental Hygiene to make sure there were more slots available for mental health supports for families, particularly young parents with young children. I would say it takes some time, not so much to bring people on board with the concept, but to have consensus about what this looks like in one's community, because it can look different ways for different organizations and communities. So part of our job is to lay out the framework and provide tools to operationalize the framework, but we don't necessarily say this is what it should look like in each place because of how contextual these can be and because different challenges are facing families in different places. I don't know if that answers your question. Do you have recommendations for the types of questions to ask families? A sample survey. That's from Kelly. Yes, we do. Actually, I'll drop in the chat in just a moment. We have a parent voices guide that came out this fall. That is the culmination of a lot of work we've done with our parent advisors. These are people who are parents with lived experience of having had or currently have a low income, who we compensate as experts on their experiences. They provide feedback on our materials, participate in convenings, and they have weighed in on some sample questions. And we have a focus group guide that we've developed. I would say that there's some principles that we utilize. One is always focusing on the strengths of families versus kind of taking a deficit lens. The other is to ensure that the group of parents that you may gather are fairly compensated, that childcare is provided. Providing food makes a really big difference. And also that there's a real racial equity lens. So are the families that you've gathered to hear from representative of the community you're serving? And then the other piece we've learned is that it needs to not just be a single feedback loop. There needs to be a way to continue to hear from families in a regular way and play back to families what you've done differently or not been able to do differently as a result of what you've heard. But I'm happy to share that Parent Voices guide, and we have a sample list of questions that other partners have used. So Anna, you've asked another question, which is about the MOUs I mentioned. Do these also cover data sharing, or do you have separate data sharing agreements? That is a great question. So they cover data sharing only in the sense that typically there's a shared agreement as to what data is going to be shared, but it does not get into the nitty-gritty of how it gets shared usually. I would say this is one of the areas for more work in the field. One of the things we've seen success with in some communities is the organization works with the local school system to assign the child an ID number so that as the child transitions from early childhood programming into the K-12 system, the organizations can continue to track the outcomes for that child. But there are data sharing agreements. I'm thinking about one that's actually, I think, from Tennessee. So let me see if I can find one or two of those that have been published as part of evaluations of programs. They may not have been from organizations that had a formal MOU. I think the data sharing agreement kind of took the place of that MOU, but let me see if I can get you one or two of those.
Okay, now I'm going to ask you to shift gears. You've done a good job of sharing us examples that worked. Can you give us examples? You don't have to name names.
Yeah.
Communities, but where you've seen either organizations or communities stumble on doing this work.
Yeah. So I probably will sound a little bit like a broken record, but I think the biggest stumbles are actually around when organizations make assumptions about what parents need and want and or parents' readiness for this. So I think that I gave the example of the organization that spent quite a bit of money to develop a welding workforce program and then had to scrap it entirely. So I think that there have been examples where building something before you know if it's what families need and want is a big mistake that organizations have made. I think the other thing that organizations need to think about if they're working in community and directly serving families is the reality is often these approaches start with some form of philanthropic funding. And without a strategy to work with or identify some kind of realignment of resources from the public sector, you can have great outcomes, but if you haven't started to think through from the beginning how you're going to make this sustainable using public sector funding, it can be very challenging. So an example would be we have actually seen a lot of success from community action agencies who partner with workforce boards, libraries, health centers for 2Gen approaches. And they are able to now use their LIHEAP funding, which is the lighting and heating funding from HHS. There's a lot of flexibility in that funding, actually. And they use LIHEAP there's at least 5 community action agencies that are using that to sustain the coordination and integration of the services I just mentioned. And we have a case study on that, actually. But I would say that focusing solely on getting a pilot off the ground with philanthropic money is a mistake that organizations make because it doesn't take into account the need for aligning their funding streams a little bit differently for the long term. The last thing I would say that I think has not worked is not all families are ready to go through and or commit to some of the supports and services that I've outlined in a 2Gen approach. And often things come up in people's lives, right? Like it's really hard to uh, take care of dependent children, to go to school, to have a job. And so I think just being very mindful of timelines and um, listening to families around what is the timeline that's going to work for them is important. And related to that, I would say this is a challenge that we are grappling with and people have been grappling with for at least 40 years, which is the benefits cliff. And I just have to say, for many families, they can go through a robust workforce program, and if they have to choose between making $5 more an hour or their child losing their Head Start slot, they're gonna decline that higher paying job. So I think it's always important to acknowledge there are some policy issues that are barriers to organizations that are doing this work really well, but are still encountering some of those very frustrating um, issues. And there are states that are testing out reducing asset limits in recognition of this, but that's a longer term issue.
Yeah, we were actually having a conversation about that related to our TANF program just
Yeah,
recently.
and Martha O'Brien Center has been doing some really great work on that. I think actually Tennessee, Massachusetts, and a few other states are trying to be. I think there's more promise at the state level than there is the federal level around that.
Yeah, I think you're right. I think you're right. Well, okay, so then my last question I wanted to ask, like kind of tactically, are there any specific like staffing shifts or specific kind of competencies or roles that people ought to be thinking about as they're leaning into this type of work?
So I would say a few things. One is this is this is really about a culture change within an organization. It's not just about one person becoming a 2Gen manager or coordinator. The most successful organizations who are doing this work have approached it with really a mindset shift for their staff and their board. And that means when the team comes together to talk about why this approach is effective and meaningful, they bring frontline staff, they bring janitorial staff, they bring vendors. There is a sense that it's important that everyone be part of this culture shift and acknowledging that it does require a different way of working is really important because people are already working really hard on behalf of families, and it's not to suggest that they're not doing a good job doing that, right? In many instances, People who are working within direct service organizations for families are doing the absolute best that they can under challenging circumstances, often created by structures and systems that have a lot of barriers that community organizations try to work around. So I think it's important to acknowledge that this is about a culture change, and it's also something that, from a staffing standpoint, does require potentially a different way of communicating about one's work, and that there is a need to track outcomes for children and the adults in their lives. That is the differentiator. And so thinking about what would it take to do that, is that possible to do on your own, or who else needs to be at the table to help you do that? And who will be accountable for some of those outcomes, and just having candid conversations about what that looks like. We have a slide that I didn't share today, but that is in a resource around tracking outcomes, that is about the continuum that organizations are on in this work. And some organizations are at the mindset stage, right? You're thinking about this, you believe this is the right thing to do, and you are bringing staff together around this new way of working. Some organizations are at the strategy stage, and that is where you are thinking about how to deliver services and work differently on behalf of families, including building partnerships to help you do so. And some organizations are at the 2-gen organization stage, which means that you have begun to track outcomes for children and the adults in their lives. Organizations may be at the strategy stage for quite a long time, and that doesn't mean that it's not meaningful and valuable work, because you have begun to work differently on behalf of families. We'd like to see more organizations move to that organizational standpoint, but we also know that it's not where everyone will end up. And I can share this report that I'm referencing, because it talks a little bit about the tools and measures for outcomes for children and the adults in their lives, and how there's different ones that organizations can be tracking.
That's really helpful. I love the idea of it being a process and a spectrum, and it's not just a like flip the switch
Yeah.
and
Yeah.
you're there. Does anybody else have other questions? I actually do have more questions that I'd love to ask Sarah, but I also don't want to monopolize. Does anybody else want to
I
come up?
have just a quick question about resources online. Do you guys, and you may not, and that's okay, but do you guys collect a list of grants and things like that that would be available for organizations when seeking to implement these kinds of programs, like AmeriCorps or things like that?
Yeah. That's a really interesting idea, actually. So we have a network, and the network is free to join. You can, Brian, you can circulate my email. But we would love, so the network is open source and free to join. We really see the network as a vehicle or a mechanism for field building. So network partners receive priority invitation to our roundtables and convenings. We look to our network first for harvesting tools and resources, insights, examples. We prioritize our network when providing technical assistance, presentations like this. And we do send out a network e-news, within which we try and identify specifically 2-gen funding opportunities. But what you're sparking for me, Maggie, is there are evergreen funding opportunities. AmeriCorps is actually a great example, because there's organizations that use AmeriCorps as a way to staff some of their 2-gen work. And it might be helpful for us to use an upcoming e-news to spotlight that. But for those of you who are on this call who are interested in joining the network, you can feel free to reach out to me, and my colleague Jordan will follow up. There's just a short survey we ask you to complete, which gives us some insight into where you are in this work. But that's really all the request or expectation is.
Yeah. I'll put a plug in for that. We joined the network, and y'all have been incredibly helpful and lots of good resources. And if you're not on that newsletter, it is just chock full of information, and you guys should all sign up for it. Okay, well, we're coming in on time, but I guess I'd love to just kind of get a sense for I recognize that this is a process, it's a culture shift. It's, there is not necessarily like a firm end goal in mind. But when you see communities who are trying to embrace this approach, what kind of a timeline would you say would be appropriate for us to kind of set our expectations around making a shift to a more kind of holistic two-gen approach? This
Yeah.
isn't going to happen overnight, but like, is it going to take us a decade or is it going to take us
I
a
think
couple
it
years?
depends on what you want. I think it depends on what success looks like for you.
Okay.
So I think making sure that so what we often say is the North Star is not like 2002 gen approaches. The North Star is better outcomes for families. So what is your North Star and how do you want the two gen approach to help you get there? And that I think really helps determine the timeline. I'll give an example, which is about 10 years ago, the Community Action Agency of Tulsa County, which has 16 Head Start and Early Head Start sites, set a goal that their North Star, even though they were in the business of early childhood development, they realized that the best predictor of those kids' long-term outcomes were their parents' educational attainment and economic mobility. And so their North Star became family economic security for children enrolled in the Community Action Agency. And they developed a partnership with the Tulsa Technical College and the local hospital system. And they developed a coaching model and a stackable credential training model for parents to get their LPN and then RN and CNA. And then they had a track around health information technology for people who didn't want to work directly with patients. And they had some philanthropic funding to evaluate this. So they were able to make it a randomized control trial. And what they found really fast was that the children of parents who were enrolled in the 2Gen program had much higher attendance rates to school than the children of parents who were not enrolled in the 2Gen program. They also found that the parents enrolled in the 2Gen credential program had reported lower rates of stress, in part because they felt like they were on a path towards more stability than they were before. And over the course of the first 3 years of that work, they were able to leverage it for a health professions opportunity grant through HHS for $10 million. So I give that example because that is probably a decade long of work to start seeing outcomes, but the successes came relatively quickly based on what they were going for. But I think it looks different based on what your North Star is. What is success for you, and how does the 2Gen approach play a role in getting there? And I generally think that the timeline can be anywhere from 3 to 5 to 10 years. But I don't think that this is a 1 year initiative that generally, I think it's useful to set certain measures of success in short-term chunks, but that long-term, that North Star is usually going to take a little longer.
Yeah, that's fair. That's great advice. Well, this was an incredibly helpful, Sarah. Thank you. Just for me personally, I feel like I want to thank you. I learned a ton, but from everybody else on the call, I'm sure they did as well. Brian, did you have anything else that you wanted to share?
Yeah, our team did have a few slides, but we thought it'd be important to pivot and just let you all know that we'll be discussing more about 2Gen and how it applies to United Way's work specifically coming up this week, tomorrow at 11 and Friday at 9 Eastern Time. We have a webinar to explain the upcoming changes to United Way's grant model and how we're incorporating 2Gen work in its entirety through our 2030 impact agenda. So we'll leave that there. And then in December, on the 10th and the 12th, those webinars are going to be specifically for grant making training and to get y'all prepped and ready for the application process, which will then open up in January. So those are two sets of dates for you all to keep in mind. But yeah, Sarah, this was absolutely incredible. We appreciate all the wisdom and examples that you provided, and hopefully that will get all of our creative juices flowing a little bit and figuring out how we can best incorporate these ideas and works into all of our programming.
Yeah, thank you. And I just want to say showing up to hear about it is the first step. You're already ahead of others. So I just want to say thank you for being here, for your thoughtful questions. And really, we we want to be a resource. We want to be as supportive as possible of deepening and scaling these strategies. So very much encourage everyone to join our network and to reach back out to me with questions. And Brian, I'll follow up with you with some of the resources that I mentioned or that we talked about in the chat.
Yeah, perfect. And then our team will package that up and send it out to everybody. So yeah, thanks again. And Sarah, I have no doubt you'll be hearing from several of us with some follow-ups. So thank you again. And yeah, we'll just leave it there, y'all. Thank you to everyone for coming today, and we look forward to seeing each of you soon.
Bye. Thank you.
Take care.
Thank you, everybody.